a teamwork. The prosthodontics is the one who decide and give and make the treatment plan by choosing the number and the treatment that should be done in the end.
And does it have a special size? The implants, do they have a special size?
Of course, the size is being classified by the diameter of the implant. It's been shown in literature and in studies that the wider the diameter of the implant, the better the implant can transfer the stress to the bone.
Yes.
So if we want better longevity of implant, the wider the implant, the better
the outcome.
The success, yeah.
Very
but
good.
we are limited sometimes in some area in the mouth that we cannot place a wider implant.
Yes, it depends on the bone density and the bone thickness and the diameter of it.
Even if we have the bone density and the bone thickness, we cannot place a wider implant in certain area because the diameter of the implant has to be related to the size of the crown or the tooth that will
the
be
prosthesis
replaced.
on top.
Yes.
Yes, yes.
So for example, if we are talking about the lateral tooth in the side, which is a very small tooth, and we have the bone, but we cannot place a bigger implant.
Yes. We will take a break now, Dr. Isam, and we will be back and talking about other cosmetic dentistry for our patients.
Hello, my name is Dr. Hussein Gadampari. We are working here in Amiri Hospital Dental Center. Today we're doing like the final stage of cementing a crown. This is the second and the final appointment for this patient. Okay, this is what we're doing today. We're having the model, the final model with the final crown there. So what we're doing today, we're cementing a crown on the patient. So this is considered the final stage to cement a crown. The first appointment was we took an impression. Today we're having the final model, and today what we're doing is cementing a crown. Okay, so let's do it now. Okay, so now this is a tooth without the temporary. We will try to fit the final restoration. We will check the contact, occlusal contact, proximal contact, and then we will proceed for cementation. So we were checking the crown now, okay? First, we will check the marginal fitness, make sure the crown is seated properly, there is no gap, nowhere, especially in the line angle area. Trying the proximal contact. Okay, we have to make sure there is a contact. Okay. And then you can take this out. We will try the occlusal contact now. Sucker, close down. Open. How do you feel? Bite down? Feels okay, all the teeth touching properly. Open. So now we will proceed. Everything looks fine. The marginal fitness is good. The proximal contact are fine. Occlusal contact are good. So we will proceed into cementation. However, we notice a color change. So what we're doing, we're trying to modify the color. So we're probably going to give the patient another appointment. We have to change the color. We need to have like, a lower value with a darker shade. So that's why you have to reschedule the patient for another appointment for cementation. Thank you.
Dr. Isam, we're back and we're talking about the coordination for our patient about his missing teeth. What's the third option that we spoke about? And we would like to expand on this with our patients, as we can see in our picture.
Yes, Dr. Ghada. The third option is the removable appliance, or we call it the removable prosthesis. It's an option that could be used in a different ways. One of them is could be used to give the patient a prosthesis after they lose their teeth. If they had a treatment plan of extraction of some of the teeth or all the teeth, if they have a decay or a perio problem.
Especially if they're diabetic, I guess,
Yes.
and they have a lot of infections in their gums and they start losing their teeth.
Yes, and the teeth are hopeless and they have to be extracted. So the other the option that's been left for the patient is the removable appliance.
Appliances.
The removable appliance could be a full complete denture, replacing all the teeth, or it could be partial denture, replacing some or many teeth. We have to understand that the removable partial denture is a good treatment for some patients.
Very
if they
good.
don't have the pain, if they don't have the bone, I mean.
Yes.
If they don't have the medical history, which I mean they could have some diabetic problems, they could have some heart problems, or they could be pregnant, for example. So they are not fitted to have the implant to be placed. So the removable partial denture is a treatment for them. Also, the removable partial denture can be a treatment for some patients who are heading to the implant.
Okay. So it's a temporary transition.
Yes, temporary
until
transition.
they, like if a pregnant lady is there, she wants to deliver after a few months, so you put the partial dentures until she delivers.
Yes, so it could be a
transition zone.
Transition or temporary prosthesis, or it could be a final prosthesis, as I told you, for some patients. Also, as I told you, it could be also for emergency use sometimes. You could lose a tooth in the front for an accident.
Yes, and there's a wedding coming soon.
And there's a wedding coming.
Or a party, yes.
So you can use maybe to replace one tooth or something.
Okay.
Just, you know.
What about since we mentioned this about losing a tooth or there's a trauma to the teeth, especially the front part. What about this composite mixture that you put and you fix the teeth as if it's a normal teeth? Does this work?
That works sometimes, but if we lost a tooth, sometimes it's very difficult to place it back, and it looks fine. It's going to look fake or not natural. That's why maybe to have the flipper, we call it, or a removable partial denture, as just an aesthetic aid to help the patient looks good and function, you know, nicely.
And usually with the trauma, does the tooth lose its normal color, and why?
Sometimes when there's a trauma and we don't lose the tooth, we could lose the nerve inside the tooth.
Okay.
What happens is the tooth become dead or non-vital, we call it.
Non-vital, yes.
So the color and inside the tooth becomes some kind of dark.
Yeah, grayish.
Grayish,
yes.
Exactly. Where we need to have some kind of bleaching, which we call internal bleaching, to help restore the color back to normal. Or maybe we might need, you know, the veneers or just the cosmetic filling just to mask the color that have been placed over the tooth.
Okay, we'll talk about the veneers, lumineers, and the bleaching and the other part of our episode today. But first we want to talk about the strength of the implant. After taking the measurements and the fittings for our patient after the implant, and you want to put a crown on top or the prosthesis on top, how strong is this prosthesis for our patients, and what do you advise them to eat on that prosthesis?
Usually when the implant is successfully placed and everything is fine, the implant become part of the bone. We have to understand that there is no space or there is no anything between the implant and the bone. So they become one piece. The natural teeth has what we call the periodontal ligament surrounding the tooth all the way inside the bone of the human being.
Yes.
That's why sometimes we could feel more with the natural teeth than we feel with the implants. That doesn't mean that the implant is not a good option. It's the best option sometimes for a missing teeth. But
like we can see in this picture with the mandible.
With the mandible, and we can
and
see
the teeth are
surrounded
in a straight alignment and they're surrounding it, but it's fitting.
There's a periodontal ligament which surrounding the tooth in a 360 degrees.
Very
that help us sometimes to feel the pressure and to help us sometimes to slow down when we eat, when we put too much pressure on the teeth. Sometimes with the implant you don't have this sensation or this feeling. The implant could be strong, they could last forever.
But what can they eat on it? This
they
is
can
my
eat everything.
even nuts. I don't want them to take nuts or break like nuts. Some of them like to break the hard-shelled nuts with their teeth.
No, I will tell them to buy a nutcracker, which will be better than breaking their teeth.
With their teeth.
Actually, even with the people with the natural teeth, we tend to tell the people not to use their teeth for everything. There's
a limit.
There is a lot of people that use their teeth for everything.
Yes, they even open Coke bottles, like let's say, with their teeth, which is very bad.
There's a lot of things they can do with their teeth.
Yes.
It depends also sometimes with the culture and with the ethnic background.
Yes. Dr. Isam, we will break now and we will be back with cosmesis in dentistry.
Hello, dear viewers in Kuwait TV. My name is Dr. عصام الحزامي. Welcome to my clinic, and I will talk today about the bleaching in office, which we call sometimes the laser bleaching. As you see, the patient, we just finished the scaling and cleaning of the teeth. We're going now to do the whitening or the bleaching in office, but before that we have to make sure that the patient is fit for the bleaching process. We make sure that she or he doesn't have any fillings or crowns or cabs in the front teeth, because any artificial fillings or cabs, they are not going to be whitened with the whitening. After we check all of this, we make sure also that there is no decay, there is no caries lesion, there is no problem, there is no gum problems with the patient. If everything is fit, everything is fine, we can go ahead after the scaling and cleaning of the teeth, we can go ahead with the whitening process. As you see now, we have a device that keeps the mouth open. It's very comfortable to the patient. The device makes sure that we have one position so we can put the light of the bleaching and we can get the maximum effect. Also, the idea of this device is to prevent the cheeks and the lips from touching the whitening material. The whitening material is a little bit acidic, so we don't want it to touch the patient's soft tissue. Even if it touches the patient's soft tissue, it's not going to be very harmful. It will heal after 1 day or maybe a couple hours. But as a cautious, we want to be careful and we want to do the process in the right way as recommended by the manufacturer of the material. Now, as you see, we're going to apply the isolation material. The isolation material, basically it isolates the teeth from the gum. So when we apply the material, the bleaching material, we make sure that the bleaching material will not be in contact with the soft tissue or the gum, as we see now. Now we're applying the material, the separation material. Also, if you notice, this tooth is a crown, artificial tooth, so we're going to cover it because we're not going to bleach it, or we're not going to use the bleaching material in that tooth. Now we will apply the whitening material. It comes in a syringe and it should be kept in the fridge before we use it in the patient's mouth. We use a brush to make sure that maximum contact of the bleaching material to all the teeth. As you see, we're trying to spread the material to contact all the teeth. Now, after we finished with the isolation, we're going to apply the lightening to the patient and we start our first session. This is the light, and as we see, we apply it to the patient. We put the protection for the patient from the light. The session is 15 minutes, and we have a total of 3 sessions. After the 15 minutes, we will clean the material, the old material, and we will apply a new material. And now, after we finish the 3 sessions of the whitening, each session was 15 minutes, we clean the patient, we remove the separation medium or the plastic thing we put out the teeth, and now we're going to apply the fluoride, and you can see the result at the end of the session. I hope you had and enjoyed the experience of whitening in office, and I hope it was very beneficial for everybody. Thank you.
Dr. Isam, we would like to continue with the cosmetic dentistry. Concerning smokers, this is a very bad habit that patients have, especially in all cultures, we can say. Either it's the hubble bubble, shisha, or the smoking, or the cigar smoking and everything. It causes very bad staining to the teeth. What is your advice to our smokers before we talk about what cosmesis we can do to them?
Okay. My advice as a health giver or as a doctor is
educationalist.
Education. Yeah, I mean, you cannot change the lifestyle of people. You know, the people, they have their own lifestyle. They wanted to enjoy it in a different way. We don't have control over their mentality or what they will do at home or at their quality time. What can we do is we can help them, we can guide them, we can tell them if they are doing well with the cleaning, with the oral hygiene or not. Usually, a lot of people, you can tell they are smoker. You can
because of the staining on the teeth and their gums.
Exactly, because of the staining, because of the color of the gum, the pigmentation, the melanin inside the gum, which become dark, the gum. Also, you can tell by their breath, you know, you can when they sit next to you, or you can, you know, just smell by their clothes. As a dentist, my concern is the gum and the teeth. What can I tell them is to improve their oral hygiene, try to use maybe the electrical toothbrush that help to
remove part of the stains?
All the stains.
All the stains, it can remove.
I have a lot of patients, they are smoker, and they could be a heavy smoker even sometimes, but nobody can tell that they are smoking because the way they developed a good oral hygiene.
Very good.
They know how to clean. A lot of people I found that they clean, but they don't clean properly. So what they're doing is they're cleaning and they think they are cleaning, but in real life they're not cleaning very well. They're not hitting the places where they should be hitting when they clean. That's why the black deposit, the black is being covered by the smoke and the tar inside the cigarette
and everything. Yes.
And that's what we have the staining in some people.
Concerning the staining, we would like to see with this picture that we have here. This is like a bleaching cap. We would like to talk about bleaching. Which do you prefer? Clinic bleaching or home bleaching, and what's the difference for our patients?
Okay. Usually, we have to understand is the whole idea of bleaching is we use a certain chemical that deposit over the teeth, and this material disintegrated, and they withdraw the staining inside the teeth. So the idea is very basic.